Hey, beautiful mums. I'm Belinda Joyce, and welcome to Midwife in Your Pocket, the podcast where I share quick, practical wisdom for your journey through pregnancy, birth, and early motherhood. In just 5 minutes, we'll dive into topics that matter most to you. So grab a cup of tea and let's get going on this wonderful adventure together. Today, we're tackling a topic that many parents dread: teething. Most babies get their first teeth between 6 and 12 months of age, but the journey can vary. Some babies are even born with teeth, while others might not see them until after they're a year old. Regardless, teething can be a challenging time for both you and your baby. The most common teeth to come through first are the central to bottom teeth, and then usually closely followed by the two central top teeth. But they can come in any order, and most children will have all 20 teeth by the time they're 3 years of age. For some babies, it's a painless process where parents notice a tooth and there have been no symptoms or teething prior to this. But for many, there's some pain associated with the tooth cutting through the gum. How do you know if your baby's teething? Look for signs like red cheeks, dribbling and drooling, being irritable, biting on their own fists, having red swollen gums or feeling lumps under the gums, biting your nipple or bottle teats or their dummy. Sometimes they can pull at their ears. Many babies get a nappy rash while they're teething. Also, refusing feeds because their mouth is sore, or even refusing solid foods as well is a really common one. And these symptoms can come and go for many months with no teeth erupting, and it can really disrupt your baby and your own sleep patterns in the process. So, if your little one is showing signs of teething, there's some strategies that can really try to ease their discomfort. You can try rubbing their gums gently with a clean finger. That seems to really help, and they'll often bite down on your finger at the same time. There's many different teething toys available. Often they're made from silicone or latex, and some of them can be put in the fridge to make them cold and then given to your baby to chew on. Just make sure you don't place any of the toys with gel into the freezer, as they can split open and leak. A wet face washer placed in the fridge or freezer is also really relieving for your baby to chew on. And if they've started solids, things such as cold yogurt, fruit purees, and frozen fruits can really relieve the discomfort as well. Teething rusks can be good for chewing on and provide a little relief as well. Some parents find over-the-counter teething medications can be really helpful, as well as medications such as paracetamol or ibuprofen. If you're using medications, it's important to follow the directions really carefully, and that these shouldn't be used every day for long periods or even multiple times a day. That's not safe. Talk to your health professionals if your baby seems to be this sore. Teething gels can help, but remember they're still a drug, so always follow the directions on the tube. I get asked about amber bead necklaces quite often, and some parents really do find them helpful. But because they pose a choking hazard, they're not recommended by any health professionals. There's also no research that shows that they do reduce the pain of teething. If you do choose to use these, it's best to remove them before your baby goes to sleep. It's important to remember that while teething can be painful, your baby shouldn't be inconsolable for long periods of time. If the symptoms persist or worsen, it's important to see your doctor or even head to the emergency department if it's out of hours for a health check. Also, contrary to popular belief, teething isn't the cause for fevers or other illnesses. However, it is common for babies to get quite run down when they're teething and contract these viruses at the same time. Teething really interrupts good sleep patterns, so as soon as your baby's tooth comes through and their pain has reduced, It's worth trying to get them back into their good sleep habits. Teething is another milestone in your baby's journey, albeit a challenging one. Hang in there, this phase will pass, and soon your little one will be smiling with those beautiful pearly whites on show. Remember, you're not alone in this journey, and remember to always take care of yourself too. Thank you for tuning in to Midwife in Your Pocket. If you enjoyed today's episode, don't forget to subscribe for more bite-sized wisdom and connect with me at belindajoyce.com or on Instagram and TikTok at belinda_joyce_midwife. Remember, you're not alone on this journey. And until next time, this is Belinda Joyce, your midwife in your pocket, signing off. You're doing an amazing job, Mama.